Hi, in this video I am going to give some small tips or pointers about scoliosis. So scoliosis, as we know, is a deviation in the spine. The normal spine has to be straight when we look at it from the front, but there will be some small curves in the spine when we look at it from the side. So in scoliosis, even when we look from the front, the spine is not straight but curved. Now this is easier to say but not so easy to identify. Many people think that if there is a curvature in the spine, by just looking at the child from outside, you will be able to make it out. But many times it is hidden. Curves of sometimes even up to 30 degrees of deviation from normal can go unrecognized, can not be detected by just looking at the child. Of course, in some cases, the curves can be detected early. For example, when there is a scoliosis that affects the lower spine, where there is an imbalance in the hip, or sometimes when it affects the upper spine where there is a deviation in the height of the shoulder from one side to the other side. But those that affect the mid spine can stay hidden for a long time. And in these cases, it is important to find out what is the test that is required to be done to find out there is scoliosis if there is a suspicion. Now, a simple test is called as the forward bending test, what we call as the Adams test, where by standing behind the child has to be made to bend forward, and you look for an unevenness in the back. That if there is a hump on one side, normally when the child bends, it should be flat. Both sides should be same. But if there is a hump on one side, that means that there is a deviation somewhere, and it has to be evaluated. That's not like a confirmatory test, but it has to be evaluated further. Now, you might ask, why are we discussing about this? Because it is not, scoliosis is not as infrequent as we think it to be. Now, incidence says that there is a really nearly around 0.5 to in some races and some regions up to 4% incidence of scoliosis in the general population. Even in cases where it is not so prevalent, not so common, 1 in 200 child can have scoliosis. And in all these cases, it doesn't mean that it is so bad that it has to be intervened, some surgery has to be done. It is going to affect the child's future. Most of these scoliosis are very small, very minor, and less than 30 degree scoliosis, we don't have to do anything. Just postural changes, regular exercises, sometimes even wearing a brace can prevent progression of the scoliosis until the child reaches skeletal maturity. But in some cases, especially scoliosis or curves that are increasing year on year, especially when the child is growing between 12 to 18 years of age, these curves can also grow. They can become more and more deviant from the normal curvature that was required. So in these cases, it is important to identify that it is not increasing in size, properly monitored, and then if it is increasing beyond a certain degree, like say around 40, 50 degrees, sometimes, depends on the age and depends on the curvature, depends on the situation of the spine. So depending on that, a surgical intervention may be required. Now, modern advances that are there in surgery in these cases, in scoliosis, has actually turned this mountain into a molehill. So these are easily tackable if recognized early, and if treated in the correct way. A deviated spine can be converted back into a straight spine without any significant major risks. And with all the advances of robotics, with all the advances of intraoperative 3D imaging, neuromonitoring, the surgeries are very, very safe in children. And it will also help these children to grow into normal adults and lead a normal life. It is a myth that people with scoliosis or bent spines will not be able to lead a normal life. In fact, once the scoliosis is treated, these kids can grow up to be normal adults and they can lead a normal life. Remember, scoliosis is not the end of the road. It is just a small curve in the road which can be straightened. Now, that is why you take the test, trust your gut, and let us handle the rest. Thank you.